Hey everyone, welcome to this week's live stream. Thank you so much for joining us, those of you that are here with us live. We're going to speak about the 7 ways to help improve stiffness and pain 1 year after having a knee replacement surgery. So for those of you that are joining us on the replay, or if you're here live with us, if you've had a knee replacement surgery and you're still suffering from pain and stiffness, and it's been a year or more, there is some hope. There is some concessions as well. Like you kind of have to give up a few things, but you're more likely to move forward with a little bit less pain, a little less stiffness, if you can begin to implement these tips here. So before I get into everything, let me just type in the chat here. Let me know that you can hear me, and let me know where you're from as well. And let me know that you can hear me. Tell me where you are from. All right, so for those of you that are on live with us right now, I see many of you. Just let me know that you can hear me. I think my system's working well here. I'm going to get going with all the content here. I don't want to delay. I got to get going back to patients today, but I just always love to get feedback to make sure that that everybody can hear me okay. All right, Shirley Bassett, you're in Elgin, Illinois. Fantastic. I think you can hear me. So just let me know if you can hear me, because hopefully you did. Fantastic. Thank you so much, Shirley. All right, let's get on with this. So as always, you can ask any question related to this topic of having pain and stiffness after having a knee replacement, a year afterwards, or anything else. I'm happy to chat with you guys for a bit about it. And then we can have other discussions. There's always great questions that come up. So I'm really excited to be here with you guys to answer everybody's question. Because if you have a question, chances are other people have the same question. They're just too scared to ask, or they think it's not the smartest question. It's completely fine. You're free to ask whatever you want. Have confidence that you'll be treated with love, and I'll give you the best answer possible. All right, Abdul Majid says, nice to hear from Boston. Fantastic. And Lakshmi from Michigan. Awesome, Lakshmi. Thanks for joining us. And let's get into the question that I'm going to be, the comment that I'm going to be answering today. So this comment came from Daksha Shah. He said, or she said, I'm not sure. They said, I had my TKR, which means total knee replacement, a year before, but my knee's still stiff and tights, and bending is 90 only, and have knee pain from surgery. X-rays shows everything okay with exercise, is going to be okay. So just to translate this a little bit more clearly, what Daksha's saying is he or she has had a knee replacement in the past year. It's been a year since then. And there's still a lot of stiffness and pain. It's tight. And then they're also only able to bend the knee 90 degrees. So they can only bend to about this much. You should be able to bend your knee about this much. But the x-ray shows everything's normal. So that means her surgeon, his or her surgeon, is probably saying there's nothing wrong with your knee. I don't know why it's stiff. I don't know why you can't bend it right. That's what they always say. But they're worried now that, can they exercise? What's life going to be like moving forward? So let's get into my top 7 recommendations for improving this situation. So number 1, if you're in the situation, you're lacking motion, you can't bend your knee all the way, and everybody's probably telling you to stretch it and just force the motion. And what you've got to stop doing is stretching aggressively. It's okay for you to stretch in this situation, but you've got to look at stretching very lightly. If we had to give it a scale to work off of, a 0 to 10 scale, if 0 is you feel 0 stretch at all, you feel nothing, not stretching whatsoever, and 10 feels like you're about to injure yourself if you stretch any harder, you need to stretch at about a 1 or 2 intensity. There's scientific research that shows that the lighter stretches held for a longer time are what actually gain you the most motion. So if you're going to stretch, which I'm going to talk more about it in the second point here, please stretch very lightly. Don't get aggressive. If you get aggressive, what you're looking at is probably some swelling, some injury. You're going to injure yourself because you're going to pass a 10. The tissues inside the knee, the ligaments and tendons and muscles, potentially get a little bit torn if you take it too far. and that can cause pain and swelling inside your knee joint. So you don't want to be aggressive whatsoever with your knee. You need to stay on the lighter side on that 0 to 10 scale, like 1 or 2 out of 10. And then as far as holding it, like how long to hold it, what the research showed is about 30 to 60 seconds is the sweet spot. If you hold less, it's not as effective. And if you hold more than 60 seconds, it doesn't technically hurt you, but you get diminishing returns, which means it's just not going to benefit you that much more to hold longer than 60 seconds. So 30 to 60 seconds is the ideal stretching range time for your stretches. Now, if you've had your knee replacement a year ago, like, I'm so sorry, I don't remember the name, Daksha, like Daksha had, um, you're probably sick and tired of stretching. And I've got good news for you. The second point is you might need to just accept your new normal range of motion. In other words, you're probably not going to get that much more range of motion. Now, what I will say in all fairness, just to give your knee the best shot and give you the benefit of the doubt, go ahead and stretch, like I just mentioned in point one. Stretch lightly and see how it goes for you. But if you don't gain much more motion than 90 degrees, like I have right here on this knee joint, you're probably not going to gain much more motion anymore. Your window for stretching the tissues is right at the end, maybe even closed for you, because it's a little bit different for everyone genetically. And if the amount of effort to gain 1 or 2 more degrees is going to be incredible. In fact, it's probably going to cause more injury in you. So you might just need to say, you know what? That's as good as it's going to be. Hopefully you can stretch your knee straight all the way, because some people have trouble doing that. That I would fight more for than being able to bend it. The normal ranges of motion, you should ideally be able to get between 0 and 10 degrees. So lacking 10 degrees. If you're in that range, you should be able to do pretty much everything you need to do. If you've lost full extension and you're only getting to about 15 or even less, then you're going to have some problems with the walking, going up and down stairs. Simple activities are going to get tough because you can't straighten out your knee. Now with bending 90 degrees, it's kind of tough. You're going to run into some issues here and there. Getting up and down from the ground is going to be tough. Being able to reach your feet is going to be difficult as well. Like to, put on socks, shoes, take a shower, clean your feet, clip your toenails, that kind of thing is going to be quite difficult. And so you're just going to have to work around that and figure out how to best do those activities with your new normal range of motion. Now, if that's your situation and you can't bend it more, because if you could get to like 110, 115 degrees, which would mean 25 more degrees for you, Daksha, it would be a world of a difference. But if it's just hurting you so much, you're swelling, it's painful, you're sore, you can't really walk comfortably after stretching, and you have to stretch very intensely to do that, it's probably not worth it, and you're probably not going to keep the gains that you make. Your knee's going to want to come back to its position that it's been at for the past several months. Now, before I go any further, what I forgot to mention is if you've had a knee replacement more recently, like less than a year ago, maybe just a couple of months ago, you're going to have pain and stiffness. That's expected. You're supposed to have pain and stiffness because you just had your knee cut open and the ends of your bones were cut off essentially, and you had implants put in to replace the knee joint. So it is completely normal to experience lots of pain and stiffness and difficulty walking and loss of range of motion within the first usually couple of months after having knee replacement. For some people, it can be even longer than that. But if it's been a year or more, you should technically be fairly healed by now, as long as you haven't had any complications, which is another side note. If you've had any complications like an infection, you've had to have a revised knee joint replacement, so you had to have 2 surgeries, unfortunately, then you're a lot more likely to have problems like this a year after having the more recent surgery, if you had more than 1 surgeries. So just wanted to mention that before I get too far into this video. Let me answer a couple of I have Abdul here that commented, and then I'll come back to my list here. Abdul asks, how long knee replacement lasts if surgery is done properly? Can a man walk quickly or swim as before? Great question, Abdul. A knee replacement, what surgeons say is typically 20 years or more. And what I've seen is people seem to be doing a lot more than ever before when they've had knee replacements. So I've seen people do some light jogging, definitely swimming, being on their feet as long as they want. It tends to be okay. What is important is that everything goes well with the surgery and then the rehabilitation afterwards, which involves the patient as well. Of course, they've got to do everything that they're supposed to do. And a physical therapist is usually walking them through that process, and the surgeon's keeping an eye on things as well. So everybody's got to do their part to make sure that all the motion's gained back, all the strength is gained back, and all the activities are resumed as normal as before, and hopefully without pain, and even better than before. So 20 years is what I've heard surgeons and patients say. I can't say that I've seen anybody at that point, when they're 20 years out and they're looking at getting a revision done. They're hoping that it lasts the rest of their life when they get the knee replacement done. But if they have to have a revision, as long as they're strong enough, doctors are usually okay to do it. So let's get into the next point here. Thank you, Abdul, for that. Okay, point number 3. This is a critical one that people don't think about. Get new shoes in order to get that stiffness and pain down in your knee, because it's not stretching. It's not really like a treatment for your knee joint. But if you're up on your feet walking all the time, your shoes matter. And not to say that you can't be barefoot ever and you always have to be in shoes. I'm not saying that. I'm just saying when you're going to be on your feet more, especially if you've been having trouble with your knee replacement that you've had for a year or more, go get yourself some nice supportive shoes. You should spend the money on them. Go to the higher end store, go to that store that has the nice shoes, the supportive shoes. Maybe they're not the prettiest shoes too. They might be the uglier looking shoes that you don't like, but who cares if you can get your knee healthier? It's really important, because if you can get that swelling, that pain down, you might free up some more motion, which will translate to decreased stiffness in your knee joint. So go get yourself some good shoes. Number 4 is one that I preach about on my channel all the time. Stop the quad exercises. Now let me back up a bit. Having strong quads right after a knee replacement surgery is really important. In fact, you should be working on your quads right after having a knee surgery, because they have just cut your quads open right on the front here, the end of the quad. They've cut your whole knee joint open. And consistently after any sort of major knee surgery, the quad muscles, the muscles on the front of your thigh, shut down. They don't work properly, and you've got to wake them back up and make them work properly. But once they're working well again, and you have confidence that your quads are getting stronger and stronger, you don't need to emphasize them anymore. Now, this is a big deal, because oftentimes people will go through physical therapy for their knee replacement, and they get hammered into them through physical therapy as time's going on, how strong they need to work on their quads. And they're working on their quads all the time. They feel their quads burning. Their quad muscles are getting bigger and stronger, and it's helping them walk better. It's overall a good thing to be doing while you're at the beginning of a knee replacement. But what you're not working on typically is the glutes, which is my next point. You need to work on your glutes, because if you only work on your quads and don't work on your glutes, you're developing an imbalance, which you probably already had. If you had a knee replacement surgery, you probably had knee arthritis before. That's why most people get knee replacement surgeries, except for crazy accidents where people destroy their knees. But if you've had that chronic knee arthritis that's gotten worse and worse over the years, and it's led you to the point where you're getting a knee replacement, you have probably had weak glutes and over dominant quads. And the reason why that's a problem is because it pressurizes the joint too much. Those quad muscles come in on the front of the thigh, they attach to the kneecap right here, and then the kneecap attaches to the shin bone. And if those muscles are very strong and tight, then it pulls this way, and it pulls the kneecap into the thigh bone, rubbing the cartilage off back there, causing arthritis, feeding into an arthritis problem, rubbing the cartilage on the end of the thigh bone. And then because of the connection between the kneecap to the shin bone, it jams the the shin bone up into the thigh bone and destroys all the tissues in here. You can get meniscus tears, and of course your common arthritis and cartilage damage. All that stuff can be prevented and reduced if you focus on your glutes. So once you're done with therapy, physical therapy for being able to bend your knee better, straighten your knee better, being able to get back to walking, usually the first 3 to 6 months after having a knee replacement, now you've got to shift your focus over into glute strengthening. Forget the quads at that point, and you need to work more so on the glutes. Now, when I say forget the quads, some people take it to an extreme, and I don't mean don't ever turn on your quads at all. You're going to use your quads anyway. Whenever you walk, whenever you stand up, going up and down stairs, the glute exercises that I teach people still have you use your quads to a lesser degree. The point is to make sure that you're primarily using the glute muscles, because then you're setting your hip and your knee up to work properly, and you're normalizing the forces in your knee joints. Doing this, taking that pressure off your knee joints, should translate to less pain, less stiffness, and hopefully more range of motion in your knee joint, because you just freed up the pressure inside. All right, I'm done with my rant about the glutes. I think it's a big deal. It's not talked about enough. Too strong the quads in the quad muscles and too weak in the glute muscles. Let me get to the comments here, and then I'm going to cover my last 2 points. Miss Sharon says, hello from Montreal. Fantastic. I heard the knee surgery is more difficult than the hip replacements. Yep, that's what I've heard too. I've never had replacement joints myself, so I can't speak from experience, but I see a lot of people that have had them, of course, and consistently I hear that the knee replacement is just a little more difficult than a hip joint replacement. Not 100% sure why. Overall, though, people getting knee replacement surgeries tend to do pretty good. Overall, there are the exceptions, of course. That's why I'm making this video, because there are some people that still have pain, a year or more out after having the knee surgery. And there are those poor few that end up worse after the knee surgery, the knee replacement surgery, than they were before. And they're coming in talking about how much they regret having had the knee replacement surgery. But, vision was 2020 before that. I'm sure the surgeon has good outcomes, and they probably met patients or seen patients that have had good outcomes with that surgeon. And for whatever reason, things didn't go well, an infection happened, therapy didn't go on right, or there was some issue, and they ended up in that situation. So it's unfortunate, but it is really a tiny bit of people, a tiny percentage of people that go through that. Most people getting a knee replacement surgery, Miss Sharon, do pretty well. Trisha Ferreria says, hello from Whidbey Island, Washington. Fantastic. And you got a little whale emoji there. I guess there's whales out there. I am so jealous. The closest beach to me, the closest ocean, is a long 8-hour drive. I have to drive because I have so many kids. I have 4 kids, so flying would be, we could do it, but it'd be involved. But I'm very far from the ocean, is what I'm saying. So I'm very jealous of you. Trisha says, I had a TKR, a total knee replacement, in 2016. I feel so much better, but my knee is always sore. Recently, I did a lot of yard work and got water on the knee. What did I do to cause that? Trisha, I think it's like what I was saying earlier. You probably have over dominant quads. And when you go do some activity that is just a little more demanding than what you usually do, it sounds like this yard work, you said you did a lot of yard work. It's probably more than you usually do. Then you were on your feet for more time. Maybe you picked up some heavy stuff, or were using yard tools that required you to put some force into it. And your body just naturally, subconsciously wants to stabilize. And if your tendency is to stabilize using your quad muscles on the front of your thigh, that's going to aggravate the knees and potentially cause that water in the knee. You might get some swelling in your knee, some pain in your knee. Sometimes inside a replaced knee joint, you get a little clunk that happens, like where the components, the metal components, kind of tap each other and bounce on each other. That might happen more often in this situation, Miss Trisha. So you got to just take it a little bit easier. And I would look at strengthening your glutes. Take it easier for the short term. I'm not saying don't do your yard work or don't go do more advanced activity or exercises later on, more intense things, but prepare yourself by strengthening your glutes adequately so that when you go out and do that activity, you know that you can take it and it's not going to affect your knees. You're not going to pay for it later on. I hope that answers that question, Trisha. Got a few more comments here. Shirley Bassett says, I use Instaflex and it seems to work as long as I take it every day. Is there a benefit for using healing supplements? I think stem cells is the next question you commented on, Shirley. But I think using supplements is fantastic. Theoretically, you don't have a knee joint anymore, and your natural knee joint. So do you need to use joint supplements? I don't know, but there isn't any hard research that shows that joint supplements are absolutely going to improve your joint health or reduce joint pain. There's some mixed results in the studies. And what we know is that the supplements don't hurt you. So, as long as you don't have any allergies to any of the components, the biggest one is a shellfish allergy. If you're allergic to shellfish, things like clams, oysters, mussels, those kinds of things, then you might avoid taking those supplements. But if you feel okay taking those and you have the ability to purchase them, because they're not super expensive, you're looking at anywhere from $20 to $50 for a month to 2 or 3 months supply of the supplements. What you should do though is, if you're going to take the supplements, plan on taking them for at least 2 months. If you can even do double that, 3 or 4 months, that would be better, because it's not an instantaneous result if you're going to have one. You have to build up the supplements within your system, so because it flows all over. You take it by mouth, so your stomach has to digest it, has to go into your bloodstream. You have to have enough of it in your bloodstream to get to the actual joint, the knee joint, where you're hopefully going to have it affect you. So you have to build it up and give it some time. So I'm all for using the supplements. It's a natural thing. There isn't any hard evidence showing that it's going to make it worse. So you've just got to give it a shot, in my opinion, and see if it works out for you. All right. So Shirley says, what is your take on stem cell surgery? Great question. Oh, I'm getting Zarina here saying I have no voice. That's not good. Can everybody else hear me? I feel like everybody's hearing me okay. Maybe it's your computer, Zarina. You might check that you don't have me muted, or YouTube might be muted for you, or your system, your computer might be muted. So check that. Beryl Wicker says I can hear you, so we're good. Shirley gives me a thumbs up. Okay, going back to stem cells, Shirley. Stem cells, also kind of like supplements, they do help some people. I've seen people here in the clinic that have had stem cells, and they say they are significantly better, and they're so happy that they got the stem cell treatment done. Of course, they're told that they have to come back, in 6 to 12 months, depending on how long the effect of the stem cell treatment lasts for them. But what I always tell people who get stem cell treatments here in the office is that it's not treating the mechanical problem, the muscle imbalance, like I mentioned earlier. If your quads are still the dominant muscle when you go do leg exercises, or when you're up on your feet, or when you're doing yard work like Trisha was doing. Yeah, it was Trisha. Even if you had that stem cell treatment done, and potentially you have new cartilage cells that developed inside your knee joints, you have better cushioning in your knee joint now, you're going to wear them down right away, because that pressure from your quads is going to just smash them. So I'm all for doing the stem cell treatment, as long as you feel comfortable doing it. And you have the income to do it, because it is definitely a more expensive treatment. It's becoming more affordable now too, by the way. But you need to still address the mechanical issue, which is addressing the muscle imbalance. That's what I mean by that. So you can give stem cells a try. I think it's definitely worthwhile. So that you can avoid surgery. It's a way less invasive than having a knee replacement surgery. I think it's a good alternative before you choose to have a knee replacement surgery done. Beryl Wicker says, we are in Tennessee. Fantastic. Wish you were closer than 3 days away. Oh, I jump on a plane. We have people do it all the time, Beryl, and it's a real short flight. You'll be here in less than a day. Trisha says, thank you. Shirley says, thumbs up. Trisha says, I can hear you fine. Abdul says, I can hear. Thanks everybody for chiming in that you can hear me. Trisha says, will cannabis in gummy form help with the knee or joint pain? Great question, Trisha. I'm going to just answer this one, and I'll get back to my last 2 points, because I do have to get going. And I'll see if I have time for more comments. Cannabis, from the preliminary education that I've gotten on it, I'm not super versed in it. I have to be completely honest. But what I've seen from patients is it's a mixed bag. Some people say that it helps them. Some people say that it doesn't. I do hear more consistently people that smoke marijuana, because they come through the clinic here and there. I can't say any names whatsoever. Just recreationally, that they actually get pain relief from smoking marijuana. I'm not advocating doing anything illegal, by the way. I'm just telling you the facts. I've had people take it in gummy form as well. Not in front of me. I don't sell that kind of stuff here. That you have to have the proper licensing, and I'm a physical therapist. I'm not by any means a physician who does medicines and deals with chemicals, or pharmacist. But just my conversations with patients, I've had some that say that they felt an improvement in their pain, and others that say that they felt absolutely nothing. They felt they were just eating some very expensive gummies. So it's a mixed bag. I can't tell you with certainty that it's going to help you or not. I think you got to try it out if that's something that you want to try, and see if it benefits you. Going back to, like I said, with stem cells, though, it's not treating the mechanical problem. It may just be a short-term solution. But if that's something that doesn't cause you, intestinal damage like ibuprofen does, maybe it's better than taking ibuprofen. If it saves you from going to the doctor and getting an injection, because we know that cortisone does affect connective tissue or ligaments and tendons. If you keep getting cortisone injections over time, you can actually cause problems. And of course, if you're getting another surgery done, you need to fix that mechanical issue. That is the root problem. All these other things like stem cells, the cannabis, all the other pain medications, injections, they're short term. I'm not saying they're bad. It's just the short term. So you have to plan for the long term as well as the short term. All right, let's get back to my last 2 points here. I'm talking about 7 ways to help improve stiffness and pain 1 year after knee replacement surgery. The 6th point here is stop walking for exercise. Stop walking for exercise. I can't say this enough, because everybody in the healthcare field pounds patients, poor patients who had knee replacements. Go walk away, go get on the treadmill. In fact, here at the clinic, we have a treadmill right there. Go jump on the treadmill and let's have you walk for 15, 20, 30 minutes. If you can accomplish an hour of walking, you're graduated from therapy. Your knee replacement has been a success. Meanwhile, the next day, they're so sore in their knee joint, they're having pain and swelling, and they just think that that's normal, that they just have to endure it and bear it. What you need to do is approach walking very cautiously. Make sure that you're not overdoing it. You shouldn't be getting more swelling from walking. You need to only walk within your tolerance. I'm not saying stop walking altogether. I'm saying walk what you need to without flaring up. Build on that. Make sure you're using the right muscles so the imbalance is still at play here. And if you haven't figured out how to walk yet, I've got videos talking all about how to walk. I've got a whole playlist talking about video. I have a playlist with videos covering how to walk if you've got different problems like an ankle problem, a knee problem, a hip problem, because you need to use certain muscles when you walk. A lot of people don't get taught how to walk, and if you've had a knee replacement surgery, you have a brand new knee joint, so it's probably a good idea for you to revise or review how you're walking so that you can learn how to walk properly with your brand new knee. If you have these bad habits that got you the knee arthritis, and maybe that's the way that you're walking, and then you go walk the exact same way, potentially worse now that your muscles are weaker because you've undergone a surgery, you're going to mess yourself up. It's going to get worse. So you have to look closely at how you're walking, what muscles are weak, and what muscles are activating during the walking. That's critically important. If you're having trouble walking right now, stop walking for exercise. Go educate yourself. Go catch our videos on walking and implement that stuff, and then start to walk as long as your body will tolerate. If you're walking correctly, you should be able to tolerate 30, 45, 60 minutes, more than an hour, but you have to use the correct muscles. I see people do it all the time that have had knee replacements that come in here with pain after, years after they've had the knee replacement, and we fix their knee pain, and it's usually just the muscle imbalances that we're addressing. All right, last point here. Plan your exercise and activity around your ability. Now, bringing this full circle, bringing it back to the second point that I talked about, accepting your new normal range of motion. Like Daksha Shah said, he or she only has 90 degrees of motion in the knee currently. That might be Daksha's new range of motion. They may not be able to get more knee bending than that. So Daksha, you've got to just accept that and plan. So if you're going to take a car ride, you need to make sure you can get in and out of that car with your knee only bending 90 degrees. If you like to get your socks and shoes on by yourself and you can't quite figure out a way to get them on by yourself because your knee isn't bent enough, maybe you're going to be a sandal wearer or slippers, or you're going to have to get some help consistently from a family member to help you with your socks and shoes and to clip your toenails. And you might, in the shower, get a scrubber with a handle on it so you can scrub your foot to make sure that you can, stay healthy and clean down there on your foot. You've just got to plan your activities around there. Any exercises that you do, because you should exercise, you need to use the muscles within the range of motions that you have. You've got to just plan on stopping when your knee gets to its end range and not forcing it, because you can aggravate problems there. And if you can walk, because you didn't say that your knee was limited in straightening out, you said it's only limited going this way. If you can straighten out your knee all the way, you should be able to walk just fine. You don't need more than 90 degrees to walk. You just need about 60 something degrees to walk, and you should be fine doing that. Even jogging might be something that you can do as long as you work your way gently up to it. So just plan very carefully what you can and can't do, know your limits, and just accept that that is your new range of motion, and that's what you're going to have to deal with. And take care of your knee, because you don't want to have another knee replacement. So don't force it to go any further than it currently goes. All right, friends, that's all my points. I'm just going to go through the comments here, and then I got to run. I'm already late. But I need to just go through these comments here. So Chris says, Chris Fullen, thank you for all the great information. I had a TKR 6 months ago, doing great. Fantastic, Chris. That is so good to hear. Beryl Wicker says, I have rheumatoid arthritis with a lot of inflammation. My relief came from ginger and glucosamine with sulfates. Fantastic. Yeah, I see, just like that. I hear people that tell me they get a good reaction from these supplements and natural like herbs, like the ginger. So I'm all for it. I mean, it's relatively cheap. It's a lot safer than pain medications. Ginger is cheap. You can get that stuff virtually at any grocery store. You can get it naturally. You can get it in pill form. There's all kinds of ways that ginger comes, and glucosamine is very accessible to everyone. So give it a shot. What have you got to lose? I mean, at the worst case scenario, it doesn't work. You can go on to the more extreme stuff if you need to. Trisha says, great advice, doctor. You're welcome, Trisha. I'm happy to help. And then Beryl says, my husband puts on my socks and clips my toenails. You're so loved, Beryl. That's awesome. That is true love. You got a lucky guy there, or I should say, you're lucky that you got a good guy there. So I'm sure you take care of him as well. Trisha says, thank you. This was great. Fantastic. Well, I'm happy to do this for everyone. We'll keep doing these live streams every Monday, pending anything crazy happening, or some massive holiday, some big holiday that I need to be, I can't be on, of course. If you have questions that you would like me to answer in the live stream, just comment on any of our videos, this one, or watch our other videos if it spurs a question in you. No question is too simple or too complex. I'm doing my best to get back to as many as I can. I have a moderator that helps me out as well. So if we don't get to your question right away, hang in there. We'll probably get back to it eventually. So thank you so much for watching, and we'll see you in the next video, friends. Bye-bye.